Dr. Anderson, I'd like to ask you what is folliculitis?
What is folliculitis?
Folliculitis. I'm not familiar with that term.
It was...
Folliculitis.
Yes, folliculitis.
Oh, folliculitis is a bacterial infection of the scalp. Sometimes I see only one that may appear, sometimes I see several throughout the scalp. Yes, ma'am, that's what folliculitis is.
And, wait, hold on, I gotta keep moving what I got. I'll get back to you, Helga, okay?
If hair loss is genetic, is it reversible, and do you work with bald men?
Okay. If hair loss, is it reversible, and does she work with bald men?
Is it if it's genetic?
If it's genetic. Genetic hair loss.
In genetic, which we call androgenetic alopecia, depends on what phase that it's in. There are actually 7 phases of severity. In men, I see it varies. I have had success if the men are between the stage of 1 and 4. If they're between the 5 and 7, that's usually where it's more severe there. I haven't had much success there. But yes, I have had some success with men and women. But again, it depends on what category of the 7 phases that it falls under. Just like the lady who had the salt and pepper hair that I told you she was over 50. That was one example of androgenetic alopecia that was reversible. Just one example.
Thank you. I have one other question here, and then I see you two back there. Helga, I haven't forgotten about you. Oh, that was the same question. Great. Okay. Charlene is the owner. Charlotte's the owner of Charlotte's Hair Design. And next time she sits back here, I'm not going to.
That's why she needs to come up front.
She's not going to beat her.
Okay, I'm a hairdresser, and through the years, I've had clients bring me products like regrow. What's the other they use on the scalp that they started out before that? I can't remember the name of it. Why does it grow their hair, but when they stop using their hair fall back out?
Why does some hair care products that are designed to grow your hair when you're using, but when you discontinue, then your hair falls out?
That's a good question. That particular product has an ingredient that is the minoxidil. And the product before that was the Rogaine.
Yeah,
so there are at least, it is FDA approved. That particular ingredient only works for androgenetic alopecia. And you must continue to use it, but it's very minimal results that I have seen in my office. Some individuals, I haven't seen any results at all. But if you do stop using it, then whatever progress that you have seen, it will diminish. So that's just the way that it is designed. Yes.
Hilda?
Dr. Anderson, I noticed that you showed it the slide from dark people, black people. Is it more common in black people because of the straightened hair or weaving or some of that?
Is the condition of alopecia more subject to African American people?
I've had all ethnicities to come to me. Some of them only come for the consultation, and I recommend for them to come back for the treatments. They don't return. So therefore, I don't have the pictures to show you the before and after progress. Those who will allow me to take the pictures of the before and after, those are the ones that you saw today.
And I'm sure that's not, I have one here. I'm sure that that's not all. She just showed you a few. There are many, many more. Okay, we have a question right here, excuse me.
I noticed that you discussed ages on a couple of the people. After a certain age, does nothing work, or does age really have an effect on it the older you get?
Is age a factor?
It depends on the individual. I take each person on a case-by-case basis, and the reason I wanted to emphasize that they were over 50 is because I'm addressing a crowd that's over 50. So I wanted you guys to see that you may hear from other people, well, it's because of your age that your hair is thinning, that it won't grow back, etc. So that's why I intentionally said that this particular person is over 50. Not saying that that's because the reason why. Other examples, it could be from medication. It could be from a surgical procedure. Each person is a case-by-case basis. Could be from chemotherapy. So it's a case-by-case basis.
Okay, thank you. I saw a question over here.
Excuse me.
Good morning. From a person that's been wearing hair color, from a person that's been wearing hair color for over 30 years, when you do give a treatment to your clients, do you recommend them not to wear hair color, or will it be okay for them to wear hair color?
Color or not? It depends on the analysis. Once I put the person under the microscope, I can tell if there is an extensive amount of damage or not. If a person is complaining of hair breakage, then yes, sometimes that can be directly contributed to the hair color process. In other cases, I've seen it from mechanical damage, such as the flat irons, the curling irons, the blow dryers, too much heat that's being used combined with the hair color. So sometimes it's not the hair color, but what you're doing to groom and style your hair. That is the problem.
Okay, I apologize for going over your time. Did you have a question?
You got to.
She answered your question? Okay, great.
Does pulling my hair back like that cause to lose hair too? I pull my hair a whole lot.
You pull your hair like here.
She's pulling her hair back in a ponytail all the time. She wants to know if that causes a problem with her hair growth.
Make sure it's not too tight, and make sure you do not use rubber bands. You want to always use a covered ponytail holder. Okay?
Now, Dr. Amerson is having her second cruise, and she wanted to show you a video. Unfortunately, time will not permit. However, she does have some flyers here. On your way out, ladies and gentlemen, stop by the table, pick up your flyers. Of course, if you have any other questions or concerns, Dr. Amerson may have time to answer some of you on a more individual basis. You can pick up
I want
her.
to make a brief announcement before you close. Can I do it?
Okay, we have counter the table, pick up her business card as well as her cruise information, and you guys can go from there. Now, are all minds clear?
Yes.
Yes. Okay, well, I want to thank you guys again for coming. I appreciate you, because without you there would be no Women's Network talk show. And I hope that you have got something out of this. I think it was very informative. I know I learned a lot today. So be mindful of the things that you take away. Know that, guys, my very favorite thing to say, and which is absolutely true, that there is life after 50. Good night.
Oh, okay. I just want to make one more announcement.
Wait. Susan has an announcement.
Would Latrell Shaw please stand up?
Latrell?
I want to recognize for Latrell. Last weekend we had the Summit Games, which was an athletic competition with lots of things. And Helga, stand up for a minute. She won the bronze medal and the silver medal. She won the bronze in the toss and the silver medal in the walk. And then I wanted to announce about Latrell. We also gave the awards called the Courageous Awards. And that recognized 5 Summit members who have overcome disabilities and our serious illnesses to keep working out, to keep volunteering to keep always having a smile on their face. And Latrell was one of our 5 recipients. It was given by Mayor Jensen.
Wow.
And we just want to I want y'all to know that, and we're proud of Latrell because she's part of us. So give her a big hand.
Yes.
Thank you very much.